Okay. Good day, everyone. I'm Swajini Bakari. I'm a current student of the Higher School of Economics, Moscow, where I'm studying cognitive sciences and technologies. And today I'll be introducing you to schizophrenia. Here is the content of this short introductory presentation. And at the end, you would be able to describe what schizophrenia is, the history of schizophrenia, the etymology, as well as the perception, how our perception of schizophrenia has changed over time, the etiology, pathophysiology, risk factors, the symptoms and phases of psychosis in schizophrenia, the diagnosis and classification, as well as the available methods of treatment for schizophrenia. But before we continue, I would like to show a short video of about 2 minutes so that we can get a feel or an idea of what schizophrenia is all about. So here's the video.
Where am I? Where are you going? Look out!
This is pointless. Even that kid knows you're stupid. Everyone knows you're stupid.
Don't go in there. Don't go in there.
Nobody cares about you. Why do you even try? Why do you even bother?
What are you looking for?
Everything's listening to you.
You don't deserve happiness.
The wine bottles.
See, they're laughing.
She's looking at you. They're looking at you.
Everybody laughs at you.
Everybody's talking about you. Because
Go
you're
ahead,
make you fat.
get some ice cream.
You don't want that.
worthless.
It'll make you fatter than you already
You've never
are.
been born.
Worthless. Pointless.
Look out.
All the alcohol. Just
Trash.
drink it all.
Poison.
No, don't take that one. No, go over to the other one.
It's poison.
Grab a wine bottle.
Go ahead.
A couple bottles of booze. Just
Drink it. Eat
drink
it.
it until you're
Look out.
passed out. Nobody cares.
Pointless.
Where did they go?
Nobody loves you. No one could.
Some junk food.
They don't
Scream.
care.
The
See?
people. They're talking about you.
Even he
They're-
can't even
You're such a
look at you.
loser. Oh, he's walking away because you stink. You smell.
Why do you
calling
bother?
Are you stupid?
They're fake
He does back
smiles.
turn you because he doesn't like you.
Get you.
Oh. And she's leaving because you're worthless.
You should have never
Oh
been
yeah,
born.
go ahead. Grab it all. Eat all the food.
Don't touch that.
Eat it all.
Don't
Why
touch
do you
that.
bother getting out of bed?
Doesn't matter. Doesn't matter how fat you get.
What are you thinking?
Go ahead. Don't eat
You
that
don't
one.
want that.
Don't drink that one. Go get some
You're
alcohol.
going to die.
Go get the ice cream. There's the, oh, you
Give
turned
up.
that one. Oh, the lights.
There.
Lights.
Where'd they go?
All right. I cut the video short so as to avoid problems with the presentation and so as to not bore us with the whole idea of schizophrenia. So from this video, we can see hallucinatory voices that the person in question was hearing. Also, you could see that this person was suffering from a lot of thought insertions and a lot of other symptoms, but very similar to what people diagnosed of schizophrenia actually go through. So, what's schizophrenia? Schizophrenia is a serious psychotic disorder that is characterized by impairment in a person's behavior as a result of impairment in the ability to interpret reality in a normal way. It is a long-term disorder that makes a person think in a disorderly manner, as also make them unable to manage emotions, make decisions, and relate well with people around them. Schizophrenia is characterized by hallucinations, delusions, disorganized speech and thoughts, as well as cognitive impairment, as we can see in these images. So where did the word schizophrenia come from? who coined the term schizophrenia, and what is the early perception of schizophrenia and other mental illnesses, and how did our knowledge of schizophrenia and mental disorders evolve over time. Early in the 19th century, schizophrenia was perceived as demence precox, that is dementia of the brain, when the brain was seen as a degenerating, it was seen as a problem that occurs from a degenerating brain. In 1908, it was named by William Leuler from two Greek words, schizo meaning split, and phreni meaning mind. So schizophrenia can be simply said to be split mind or fragmented mind, or fragmented thinking or split thinking. Please note that split mind or split thinking is not the same as split personality. They are two different disorders. Split thinking is when the person's thought is splitted, and split personality is when a person exhibits two extreme characters. When two extreme characters are present in one person, like in a day the person is melancholic, and another day the person is maybe an extrovert or something. In the 20th century, however, our knowledge of schizophrenia was more elaborated by Emil Kraepelin, who described schizophrenia as demence precox as well, but subcategorized schizophrenia into different categories, and based on symptoms and some anatomical abnormalities found through imaging methods into different categories. And all of these classifications really helped in the advent of antipsychotic medications, psychoanalysis, as well as most of the methods that we know today in the treatment of schizophrenia. Is discoveries also aided in the current classification of schizophrenia, the method of classification used for classification of schizophrenia by the Diagnostic and Statistical Manual of Mental Disorders, as well as the International Classification of Disorders, version 10. In the mid-20th century, psychoanalysis was birthed, and this further helped in mental disorders generally, but was found not to be so effective on schizophrenia. And as a result, research continued. And in the 1950s and 1960s, the discovery of antipsychotic medications occurred. It is important to discuss about the discovery of antipsychotic medications because it is a big and very important landmark in the when we discuss the history of schizophrenia, because without these medications, a lot of hypotheses about neurotransmitter problems occurring in the brain would not have come into existence. So with the discovery of antipsychotic medications came the discovery or the suggestion of several hypotheses, which suggested that neurochemicals in the brain, whether when they are hyperactive or underactive, or hypoactivity and hyperactivity, lead to the development of schizophrenia. Also, another important landmark happened in the 1960s to 1970s when this deinstitutionalization, a method in which schizophrenia patients were advocated for not to be kept in the hospitals and clinics, and they were advocated for to be taken home and be taken care of in the community. That is the introduction of community care. So, what is our current perception of schizophrenia? What changed in our perception of schizophrenia? Nothing really changed that much, but with more understanding of the potential factors that could lead to the development of schizophrenia, would agree and would say that our perception have greatly been changed and enhanced. So according to the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, as I explained earlier, schizophrenia is perceived as a psychotic disorder, viewing from a psychoanalytic point of view and psychopathologic point of view, where people undergo psychosis in schizophrenia in different phases. The same, similarly, we can see it in the ICD-10, the International Classification of Disorders, the 10th edition, also seeing schizophrenia as a psychotic disorder, with a similar method of perception to the DSM-5, although with little changes in their mode of diagnosis. So the third fact that the third part that have contributed to our current perception of schizophrenia is advances in neurodevelopmental, neuropsychological, neuroanatomical, and different kinds of research methods. According to the neurodevelopmental models, it has been suggested that schizophrenia could have occurred as a result of birth abnormalities during development in the womb, while the baby was in the womb, and then several environmental factors could have led to abnormalities in brain formation, and this in turn results in the development of schizophrenia. And in the neuroscientific neuroimaging models, as we can see, have shown that some parts of the brain of people suffering from schizophrenia are degenerated and a bit different in structure when compared to the brain of healthy individuals. The last field that has contributed to our current perception of schizophrenia is the field of psychosocial interventions. Psychosocial interventions have made us know that social factors such as our current place of dwelling, migration, urbanization, as well as rural area, whether we're dwelling in the rural area, could also impact, could also contribute to the development of schizophrenia. So what is the impact? What is the global burden of schizophrenia around the world? According to the WHO, schizophrenia is not so prevalent, with a 0.32%. That is about 24 million people worldwide suffer from schizophrenia. And the incidence rate is around 0.45%. That is 1 in 300 persons worldwide, and 1 in 222 adults can develop schizophrenia. Also, it is important to know that in men, schizophrenia tends to develop early, around the early 20s and their late teenage years, while for women, it occurs in the late 20s to early 30s. There is high mortality rate that has been attached to schizophrenic individuals as well. Not because of the schizophrenia, but because of other disorders, other health challenges that arise as a result of developing schizophrenia. Some people feel depressed post episodes of schizophrenia, and they commit suicide. Some people, as a result of their medications, gain excessive weight and develop cardiovascular problems due to their inability to go around, due to the stigma and a lot of other factors that I will explain further in this presentation. Okay, so one alarming factor is the fact that burden of schizophrenia is on the increase globally. Yes, schizophrenia is around 0.3%, less than 1% prevalent, but the burden, according to the WHO and a lot of researchers, is rising on a yearly basis. And we can see this in these graphs. We can see this talking about the incidence rate per 100,000 persons on different age groups, which I spoke of earlier, about men developing schizophrenia earlier than women. You can see it here. And you can see it as the pyramid peaks with a kind of a level of equality, and not really equal in people with old age, in old age. And here we can see the estimated annual percentage change in the incidence of schizophrenia around the world. And according to these authors, it is going to keep changing as people migrate from one part of the world to another, talking about environmental factors. So what are the what are the causes? What are the risk factors that have been attached to the development of schizophrenia? It is important to note that the cause of schizophrenia is unknown. Nobody knows what causes schizophrenia. However, the risk factors, those factors that could probably, be potential causes of schizophrenia development, have been categorized into three main subcategories, and they are the genetics or family history, neurotransmitter problems, neurochemical problems in the brain, as well as environmental factors. So when we talk of genetics, I think we all have an idea of a family history. When a person in a family develops a kind of disorder, and then the tendency of passing it on from one generation to another. I'm sure we are familiar with problems of maybe myopia, short-sightedness, or long-sightedness. People with eye problems, then they pass it from one generation to another. Then also several genes have been isolated and they have been associated with the development of schizophrenia due to some malformations in their formation. Okay, so for neurotransmitters, a lot of neurotransmitters have been associated with the development of schizophrenia as well. Neurotransmitters are chemicals in the brain that enhance the transfer of impulses from one nerve cell to another nerve cell. So some of them are dopamine, serotonin, glutamate, as well as gamma aminobutyric acid, as well as other alpha adrenergic neurotransmitters. They have been associated with the development of schizophrenia, either when they are hyperactive or hypoactive or underactive. Also, environmental factors such as abnormal fetal development, gestational diabetes, preeclampsia, emergency cesarean section and other birthing complications, maternal malnutrition and vitamin D deficiency, winter births, urban residence, migration, as well as alcohol consumption and drug use have been associated with development of schizophrenia. I'm going to give a short description of what gestational diabetes is, because that might seem strange. Other factors seem easily understandable. So for gestational diabetes is a situation whereby a pregnant woman consumes a lot of glucose, as well as a result, the glucose level in her bloodstream increases, and she passes this to the unborn child through the placenta. Then for winter births, we'll be wondering how winter, a season, has an impact on the development of schizophrenia. Yes, scientists believe that in winter and in cold seasons, there is more activity from microbes, and as a result, they can affect the development of a baby's brain parts or other parts of the body, causing different kinds of abnormalities. Then we can see malnutrition as well. Scientists have shown that when a baby is underweight, you can see here, they tend to be prone to development of several disorders, and schizophrenia have been one disorder that has been linked to this kind of complications. Okay, so that takes us to what is the pathophysiologic mechanisms. What are the mechanisms with which schizophrenia onsets, and how does it develop in people that have been diagnosed? They are similar to what I just explained. We can see here the genetics, neurotransmitters, as well as environmental factors relates to this hypothesis that have been formulated to describe how schizophrenia develops in people. First is the neurochemical abnormality hypothesis, which states that neurochemicals have to be involved. Then the disconnect hypothesis is born from MRI and other neuroanatomical imaging analysis that have shown several distortions in brains of people suffering from schizophrenia, while the neurodevelopment hypothesis focuses majorly on the people on birth complications, problems and complications attached to the birth of a baby, of a child. Okay, so these are the three main hypotheses that have been linked. These hypotheses will be explained further in different lectures apart from this, so I won't go into deep details about them. So what are the symptoms of schizophrenia? The symptoms of schizophrenia are numerous, but for easy understanding, they have been grouped into three, and they are the positive symptoms, the negative symptoms, and cognitive symptoms. Positive symptoms from the name suggest symptoms that are added, like additional symptoms, additional attributes to a person after the development of schizophrenia. A common example of this is hallucinations, just like you saw in the video earlier on in this presentation. Delusions, disorganized speech, and as well as thoughts. These symptoms are positive because they were not present in the person before the development of schizophrenia. And once schizophrenia develops, these symptoms begin to show, they begin to surface. So they are like addition to the person, while negative symptoms are like the opposite of positive symptoms in understanding, because it is what a person does before and then is being taken away as a result of the development of schizophrenia. The popular ones are anhedonia. Anhedonia is a situation where a person stops or ceases to show joy in what they used to show joy in before. For instance, a person loves to watch movies, and after the development of schizophrenia, the person does not derive joy in watching movies. Or a person loves to go on tours or travel around, and then with the development of schizophrenia, they stopped liking all of these things. They stopped deriving joy in these things. So this what anhedonia is all about. Then evolution is a lack of will. This people with schizophrenia tend to lack the will to do things. They lack the will to do things. Then the third common one is blunted affect. Blunted affect is when a person cannot show emotions. They don't show emotions, whether they're happy, whether they're sad, you don't know. They're just there. They don't show their emotions, even to their loved ones. Then the cognitive symptoms have to do with higher cognitive functions, like memory issues, inability to process social cues. For instance, somebody driving and then seeing a traffic light cannot understand what green light means, what red light means, and what yellow light means. So these are some of the complications attached to schizophrenia. Then last is the impaired sensory perception. This has to do with a person unable to process sensory perceptions appropriately. When a person is approaching a person, when a loved one is approaching somebody in schizophrenia and is telling them it's okay, you'll be fine, you'll be this, you'll be that, you need to go see the doctor, and in their mind they are hearing other voices telling them this person is threatening you, this person is going to kill you, this person is going to do this, do that to you. So they interpret every word that this person is saying to them in a different way. They sense things in an abnormal way. So that's what impaired sensory perception is all about. Then other symptoms include distractibility, anger, anxiety, depression, lack of insight, sleep disturbances, as well as the use of substance in an abnormal way, as well as overtly consuming alcohol and other hard drugs. Because when a person is unable to sleep, is hearing voices, they tend to use these drugs to suppress what they are feeling, and as a result, develop a lot of health complications. Okay, so having learned of the symptoms, we need to understand what are the phases of schizophrenia occurrence. when schizophrenia occurs in a person, it occurs in episodes. And these episodes are characterized by three main phases, because after an episode occurs, then the person tends to drop back to normal. It's like an aggravation of the symptoms. Then these symptoms begin to drop at some point. Then after some time, the episode occurs again. So this is what the phases of schizophrenia is. So that's why schizophrenia is divided into phases. So it is characterized by three major phases: the prodromal phase, the acute phase, as well as the recovery phase. For the prodromal phase, there's decline. It is characterized by decline in functioning, social withdrawal, physical complaint, as well as newfound interest in religion and occult. While the acute phase is the mid phase, where positive symptoms start to emerge. I explained them earlier. Then perceptual disturbances start to show up, delusions, as well as disorganized thought and disordered thoughts start to pop up. Then for the third phase is the recovery phase. Like I explained earlier, the episode comes, then with time it recedes, and at this point you could notice negative symptoms as well as all thinking and behavior. So this is like a mid phase between each episode, the recovery phase. So when an episode happens, then the person recovers a bit, then another episode, then the person recovers, another episode recovery, another episode recovery. So these are the major phases of psychosis in schizophrenia. So how is schizophrenia diagnosed? Having learned of the history of schizophrenia, what is schizophrenia, then learned of the pathophysiological mechanisms, as well as the causes and etiology and the risk factors. How is schizophrenia diagnosed? I explained a bit about this earlier, that according to the DSM-5, schizophrenia is diagnosed as a psychotic disorder. And this is a clinical process where a lot of assessments are carried out to cancel out any other factor that could also cause psychosis before these factors are now put into consideration. That, okay, I haven't canceled out that, the symptoms of Parkinson's, the symptoms of maybe schizoaffective disorder is not present in this person, then they can now go further to use this particular set of criteria to characterize a person's kind of schizophrenia. So the person must have suffered from 6 months, at least 6 months of persistent occupational dysfunction, plus the presence of 2 or more of these listed symptoms, which must have occurred for a significant period of time during a 1 month period. So this is the way it is diagnosed according to the DSM-5. While according to the ICD-10, it is diagnosed as in this box on the left or this one on the right, plus thorough risk assessment of past medical and family history, as well as social and history of recreational drugs and alcohol use, and canceling out potential causes of psychosis, such as Parkinson's, multiple sclerosis, and other brain problems that could lead to psychosis. Also, the presence of recent neurological impairments in such people are also checked out. Before these factors or these criteria can then be used to diagnose that this person is actually suffering from this particular type of schizophrenia. Furthermore, the person can also be sent for imaging to see anatomical malformations in the person's brain, abnormalities in the brain, using the computed tomography on the left-hand side, and you can see on the right-hand side a magnetic resonance imaging apparatus. So these are the two most robust techniques of assessing brain issues when it comes to schizophrenia, because they are able to show difference between gray and white matters when there's malformations in the brain, as well as show problems with surrounding vascular tissues in the brain. For more information about CT scanning and MRI scanning, you can check from the links below. So having known about the criteria for diagnosis, when a schizophrenia is now diagnosed, how do they group them? What are the classifications that are possible after diagnosing schizophrenia? So there are major 5 classifications, and they are catatonic, residual, paranoid, disorganized, and undifferentiated schizophrenia types. So for catatonic schizophrenia, it could either be catatonic stupor, catatonia excitement, or alternating catatonia, where catatonia stupor is characterized by a person showing some motor abnormalities, as well as catatonia excitement, but in a more exertive manner, while alternating catatonia is mixture between when a person displays catatonia stupor and then at some point catatonia excitement. For residual schizophrenia, it is all marked by emotional blunting, eccentric behavior, illogical thinking, social withdrawal, loosening of associations. Paranoid schizophrenia, on the other hand, is mainly characterized by delusions, different forms of delusions. It could be positive, it could be negative. Positive delusions like I can solve the problems of the whole world. I know how to link the whole world together just in the person's room, thinking about all of these things and writing them down in maybe a piece of white paper and doing nothing. These are the kind of delusions, or oh, I'm going to win the Olympics, when the person cannot even compete in an Olympics. Okay, so that is for paranoid schizophrenia. Then for disorganized schizophrenia type, this is characterized by, I think the name explains it all. Everything about this person is disorganized, from thought disorders to incoherence to severe listening of associations, extreme social impairment. The person cannot perform well in public. The person cannot even work or do anything. Or changeable delusions and hallucinations. Today, hallucinations, hallucinations, on and on like that. And for undifferentiated schizophrenia, it's a kind of schizophrenia in which all subtypes of schizophrenia are expressed in a particular person, or a particular class of schizophrenia is seen in a person, but not well expressed. So this is when it is termed undifferentiated, because you cannot differentiate which one is actually happening to this particular person. So what are the treatment methods that are available for schizophrenia? The treatment methods that are available for schizophrenia are majorly through medications, electroconvulsive therapy, as well as cognitive behavioral therapy, and health and drama. Nowadays, the most used methods are cognitive behavioral therapy, art and drama, and medications. These are termed as psychosocial interventions. The psychosocial interventions have been proven to be effective when combined with medications. Both methods have to be combined. They cannot work single-handedly as far as research is concerned. While electroconvulsive therapy is least used for people because it has a lot of limitations as well. So for medications, the use of oral second-generation antipsychotics is first started for anyone who has been diagnosed with schizophrenia. You can see example of these drugs on the right-hand side here: aripiprazole, olanzapine, asenapine, and a lot of them like that. Then when a person is successfully using these medications and it is effective, clinicians tend to prescribe drugs that would help them to comply with these medications so that they can continue to see improvement in their treatment. So example of these medications includes the clopentazole, fluvenazine, haloperidol, and other class of peridols. on and on like that. Then in some cases, when they are introduced to these SGAs, or second generation antipsychotics, they do not work. As a result, they are referred to as treatment-resistant schizophrenics, and they use these strong medications to help them, or combine antipsychotics as well as estradiol or allopurinol and other class of purinols to help them suppress their episodes, so that they will have rest while facing all these episodes, before using other methods like psychosocial interventions. So once this part of treatment has been successful, there is need for prophylaxis as well as rehabilitation, which is the maintenance phase. People that are suffering from schizophrenia are maintained, and then they are trained, they are shown how to be able to blend again into the community, because when suffering from schizophrenia, they tend to be socially withdrawn, they tend to be stigmatized, and this can lead to a lot of problems. Okay, so having learned of all of this, and as well as the treatment of management of methods of schizophrenia, we come to the end of our presentation. But there are some important points I want us to remember, take away from this presentation. And they heard that schizophrenia is not split personality. Schizophrenia is not schizoaffective disorder. It's not DID. It's not all disorders, because it is practically related to fragmented thinking, while split personality is related to split personality, when a person has two different personalities or more to deal with. Like bipolar disorders, they are all different from schizophrenia. They are not the same disorders. Also, schizophrenia is a psychotic disorder which requires serious and dedicated medical attention, as well as clinical diagnosis, and its cause and etiology or etiology is unknown. However, many risk factors have been suggested, and we already explained them. They relate to genetics, family history, changes in neurotransmitter levels, and several neuroenvironmental factors. Also, the symptoms of schizophrenia can be in form of added problems or added challenges or health problems, or withdrawal of good characteristics from a person, which is negative subtraction, positive addition, negative subtraction, or cognitive, which relates to cognitive functions such as memory, perception, and processing social cues, like I explained earlier. Then schizophrenia can be managed with medications, and patients can live a good life. Yes, this is a very good aspect, because most people think when a person is suffering from schizophrenia, that is the end. No, schizophrenia is not the end of the world. Having schizophrenia is not the end of the world. People can actually have it and still live a good life. In fact, about 1/3 of patients with schizophrenia fully get remission from their symptoms. Remission is not actually recovery. Some people recover, but there is not much details on recovery. But for remission, people face the symptoms, just like you can see in that video. The person could still hear the voices, still facing the symptoms, but they could still go about to do what they want to do without being hindered. And one important thing is that schizophrenics, people who have schizophrenia, are not violent and aggressive or dangerous. That is a myth, because nowadays we have methods of managing schizophrenia and they are not aggressive. They can go about doing their daily things while they hear voices, and they are never aggressive. But on the red alert is the fact that schizophrenia is bound to rise. The incidence is increasing yearly, and this is not a good one, but with research I believe that all the problems and the challenges attached to schizophrenia can be solved in years to come as quick as possible. With this, I come to the end of my presentation. And if you feel like you want to learn more about schizophrenia, here are my references. You can go online, search about them, watch some YouTube videos, although not all YouTube videos depict schizophrenia appropriately. But like the example I gave earlier on, you can watch that video in full. That's a very good explanation of what schizophrenia is all about. So I want to acknowledge, I would like to say thank you to ENIGMA-U for the opportunity to present this part of the tutorials, because it's very important to me as a student of cognitive science and technology. And I'll also say a very big thank you to Dr. John Kenny, the mastermind behind the ENIGMA-U, for making this a possibility, for making for bringing up the idea of ENIGMA-U. And also, my presentation will be incomplete if I do not say thank you to everyone who has been watching from whatever part of the world, from the beginning of my presentation up till now. And if you have any questions or any inquiries, you can contact the email enigmau2022@gmail.com, or follow Dr. John Kenny at Dr. John Kenny on Instagram and Twitter. Thank you once again.